And good evening, everyone, and welcome to this week's Maternity and Midwifery Hour. My name's Sue Macdonald, and I'm the curator for the Maternity and Midwifery Hour and the Maternity and Midwifery Festivals. And it's my delight to be chairing this evening's Maternity and Midwifery Hour. And I've got two wonderful guests, and they're into education just like me, so it's lovely. So we have Maeve O'Connell, who everybody will know because she's been on the Maternity Hour several times before. Wonderful. And Laura Moya Falcon. I hope I've pronounced that correctly, Laura. Yeah, I'm sure you'll tell me if I haven't.
Very
Now,
good.
what we do to our lovely presenters is ask them to share a little moment of the week. So perhaps could we maybe start with Maeve? Would you share a moment of your week
Yeah,
with
sure.
us?
So we're really proud this week. Two of our students, Sharina Al-Ketbi and Mara Al-Hamadi, were selected to present their posters at a conference. It's their very first conference, MediClinic in Dubai on the 16th of May. So we're very proud of them.
Oh, wow.
Nice, a nice sense of achievement for them.
How lovely. That is superb because it's a really big thing, isn't it, to have a paper accepted for a poster or a presentation, and a bit
Very proud.
scary. So well done to those two. Fabulous. Thank you, Maeve. Now, how about Laura? Have you got a moment that you can share with us?
Well, actually, yes. I'm so excited because this week in Qatar, in our organization, Hamad Medical Corporation, we have a part of the patient person-centered care
Yeah.
experience awareness week. We actually presented, we did a boost of midwifery services in Qatar. And
Wow.
this is the very first time we are presented. So this is for us, it's a huge milestone. And we were talking about the birth plan. We were talking about midwifery-led services like the antenatal clinic. And maybe for many of you, it sounds like a very common thing, but for us, believe me, this is a very brand new, and I'm so excited about it.
Fantastic. Well, it is. And I think sometimes it's lovely to hear you so enthusiastic about it because I think sometimes we do take it for granted. All of these things we have and some in countries have lots of these things and some have a few of them. But I think it's always good to remind ourselves how fortunate we are when we have these tools to make midwifery and maternity care really special for women and their babies and families. So thank you for sharing that, Laura. Now we're going to return to our speakers shortly, but I'm going to do the usual bit where I just talk a little bit about the maternity hour and then we'll do a little news feature. So I'm just going to remind you now, I know there's going to be some new viewers, so hello to you new people, and some old, or I won't say old in old terms, but people who've come every week or lots of times. You'll know about the maternity and midwifery hour. We were born in the pandemic lockdown of March 2020, which I think sometimes feels a long time ago, and sometimes it just doesn't at all. So, a word someone says can bring it all back to that time when we were all in masks everywhere and we were in queues in the shops and in all the maternity units were very quiet in a lot of ways because women weren't able to have their partners necessarily with them, and that difficulty that we had. And we started the maternity hour because midwives and student midwives couldn't go to study days, they couldn't go to conferences, and there was a real desperation for linking with each other because we love to be together as midwives and student midwives. It's very close to our hearts. But also information, because at that time people wanted to know lots about COVID-19 and what was happening in the rest of the country and in fact in the rest of the world actually. And so at that time we had a lot of material about changes in the services, about the virus, about the reactions to people. But it's kind of changed now. So we're still here, obviously, every week, but the content is changing, and we're sort of influenced really by what's interesting to midwives, what's interesting to student midwives, what's current in the news today. And also, if people send me a message and say, I think you ought to talk about education, for example, or they put themselves forward with a really good idea for a maternity hour. And so put that in your brain if you're thinking, I could do that. I'd like to be there. We'd love to have you. Because one of our speakers must have thought the same thing and has been a very loyal audience and participant in the whole process, and that's been lovely. Now, for those of you new to this, I need to reinforce that everything is recorded, nothing is missed. If your computer blows up or you get called away, it doesn't matter, you can catch up at a later point. And if you hear someone talking about something and you think, oh, I'd like to know a bit more about that, there's all of this, all the presentations are kept by the lovely Matflix, and you can go to the website, the Matflix place, and find loads of things. I think we're hitting something like 1,700 clips, and they're big. Some of them are big clips too. The only problem with that is it's very addictive. So once you start scooting through and looking and listening to people and watching all these lovely speakers, the time just melts away. But it is fantastic for those of you who are looking at revalidation in the UK, or for those of you who've got assignments to do, projects to do, or just want to update your knowledge in a particular area. Maybe you're going for a job and you need to be very informed. It's a fantastic way of learning very quickly and comfortably. So have a look at the Matflix when you've got some time. Also, we like you to share things. So for example, tonight, you're going to learn some things maybe you haven't thought about before, maybe the ICM competencies and that sort of thing, and the global standards might be new to you. And you might think, gosh, people need to know about this. My colleagues need to know. You can share this whole presentation with your colleagues and have a discussion about it. And if you're doing your revalidation, fantastic, because this can form part of your portfolio of evidence. So just to pop them in your brain, I'm going to say a big thank you to all our lovely midwives and student midwives who are working so hard, as always, actually all over the world. I sometimes have to remember it's not just UK, and this is why having Maeve and Laura here this evening is fantastic, because it does remind me that all over the world, midwives are providing care to mothers, to babies and families in sometimes very challenging situations, and often usually short-staffed. And because I'm sure the ICM International Day of the Midwife is coming up, and I'm sure that the statistics will come to say there's a huge shortage of midwives, because there was last year, and they won't have suddenly appeared from nowhere. So good on you, midwives. Fantastic. Keep on doing what you're doing. Now, especially since today is International Workers' Day. This is my news feature, just in case you didn't notice me seamlessly moving there. This month is Skin Cancer Awareness Month. It sounds a bit depressing, but it's something we need to know about. And I want to say a big thank you to Mummy Star, who it's a pregnancy and childbirth focused charity on cancer and helping women and families who are experiencing cancer to cope and get information. And they've got a really good ABCDE guide to skin cancers and how to spot something that might look dodgy. Really good. Also, have a look at the Macmillan information site. Now, all of those, and that's to remind me, that's on your resource sheet. So you can have a look at that. You don't have to, but there's a load of information that would be useful. It's also Preeclampsia Awareness Month, and that's going to be a whole month of communication to raise awareness of preeclampsia and eclampsia. And the 2024 theme is Predict, Prevent, Prevail. Love that. To remember that. Now, action for now, you know this. You know what's coming now. It's that calendar. Yes, it's the calendar. Action for Happiness. I love this thing because this, and for those of you who haven't watched me before, this is a wonderful way of just finding one little thing every day to be a bit mindful about and just try something to keep centered on normality. Now, today, there's something for you to do every day. And you haven't got much time. If you're in the UK, you've only got, about 5 hours to go and do this one. Do something kind for someone you really care about. That shouldn't be hard. Have a think about that. It's really good. And there's the link to that. The new Meaningful May, sorry, is on your resources sheet as well. Also, this is new out too. There's the Chartered Society of Physiotherapy supporting international recruitment, principles and standards. And this is about guidance for supporting practitioners and ensuring equity for international practitioners coming particularly to the UK. And this is a document that's been supported by the Chartered Physiotherapists and the Royal College of Midwives. Quite a small document, but it's worth looking at because it's one more tool against anti-bullying and making sure people feel welcome. Sounds, again, very easy. You should be able to make people welcome. And there's also, from the RCM, the new Strengthening Perinatal Mental Health, and that's also on your list. So there. Okay, now I'm going to move now, almost perfect. We're going to move on to education. I was going to say education. And we're looking at ensuring a positive clinical learning environment. And this means students, for midwives, and for women and their families. And we're also going to be looking at the ICM standards. And I'm going to say now, first of all, I'm very, very delighted to welcome Dr. Maeve O'Connell. She's Assistant Professor of Midwifery at the Fatima College of Health Sciences in Abu Dhabi. She's a registered midwife and a nurse with a PhD, and she did her PhD on fear in childbirth. And she's published just a little bit on that, so it's really good material for those of you doing any projects on that. She's got a wide range of clinical experience, and she's worked in London and Ireland. Her interests are care of the high-risk women and intrapartum care. She's a fellow of the Faculty of Nursing and Midwifery at RCSI, and that was awarded in recognition of her exceptional commitment, dedication, and contribution in midwifery. She's also a prolific tweeter, and I'm not going to say X. She's a tweeter. She's the lovely Maeve. And she's also appeared several times doing things like yoga and relaxation, which is fabulous. She's taught me, I've learned a lot about centering yourself from Maeve. So welcome to Maeve. The screen is now yours. And thank you so much for coming this evening.
Thank you, Sue. I'm delighted to be here again. Thank you so much for inviting me. I love coming on Midwifery Hour and very excited to share our learning. So if you could please share my slides for me, and I will begin. So tonight I'm going to talk all about nurturing midwifery students in a positive clinical learning environment, because this is what we are there to do. It's the essence of what we do as midwifery educators. So I thought it was a really nice topic for tonight's programme, and I hope you'll enjoy our story at Fatima College. So moving on to the next slide. So the first thing I'm going to do tonight is give you an update, because I know if you've been following our story on Midwifery Hour, you'll be familiar with us. For those of you who don't know about us, we are a team who started the first Bachelor's of Midwifery direct entry degree programme at Fatima College of Health Sciences, which is a healthcare sciences college in Abu Dhabi in the United Arab Emirates. And we started our journey back in 2021. And we're really growing. We're coming a long way. We're very proud of the work that we've done. We were fully accredited just last year. And we currently have 2 batches of midwives going through. So we have 7 midwifery students in 3rd year. We have 5 midwifery students in 2nd year. And we actually have 9 midwifery students in 1st year. And the incoming, I'm proud to announce that there's actually 17 midwifery students registered to start in August. So this is really, really exciting time to be part of this really brilliant initiative. It's really fantastic that the UAE has recognised the potential of midwifery and the power of midwifery, I guess, in strengthening outcomes for women's health and for newborns as well. It's part of the national strategy, and our college is actually under the patronage of Sheikha Fatima bint Mubarak, the Mother of the Nation, who is the author of the national strategy for early childhood and motherhood as well. So it's a really, really fantastic initiative, and it's fantastic to have the support behind us. So hopefully on the screen you can see a lovely picture of our education team. From left to right you can see myself, Joanna Andrews, Caradine Aird and Dr. Georgina Sosa. You're probably all familiar with Gina because we started out together on this journey back in 2021, but we're absolutely delighted to have Caradine join us as senior instructor in October last year, and Joanna has travelled from the UK in January this year. So we're undergoing massive change all very rapidly, and it's, like I said, it's exciting, but we're learning as we go. And definitely it's important to share the learning as we go as well, because if you're in a country where you haven't got midwifery degree program up and running, hopefully some of the tips that I'll share tonight will help you to start your midwifery program and for it to be successful as well. So these are the aims of tonight's talk. If you move to the next slide. Tonight I'm going to talk about the importance of clinical placement opportunities for midwifery students. Why do we have a clinical placement? To think about and consider what makes a competent midwife. How do we know when someone has reached competence? To explore what a positive clinical learning environment looks like. And I also want to help countries that don't have many midwives to prepare for an adequate placement site, because it is a challenge. And finally, I'm going to help you to understand what an enabling environment means and how learning objectives can be met for midwifery students when there's not many midwives, because that's a challenge that we've faced. So if you can move to the next slide, slide 4. So actually more than 50% of midwifery training makes up our midwifery degree program. It's a large part of what we do. And we're running our midwifery program in the UAE as a block system. So similar to the UK, where we do 8 weeks or 12 weeks in theory, and then we move on to the clinical placement. But we're actually front loading with a lot of simulation in the lab. So we're running our fundamentals of midwifery and our clinical health assessment for midwifery procedures, that kind of thing, in tandems. We do a theoretical component, which is linked up with the lab, which works out really nicely for the girls so that they have a sense of the skills that they need and the theory before they go out into clinical placement. So our second years have just come to the end of all their theoretical knowledge, and we're just preparing them to go into the clinical area. They'll have their first clinical placement for 4 weeks in June, the end of May, start of June. And this is a really important time, so it's actually a really timely presentation for us as well, because we're just about to start this placement for those students. Our third years are currently come to the end of their complex women and newborn clinical placement. I'm out there at the moment with them, and it's just really exciting actually to see their progress and to see them flourish. So the next slide. So let's think about what makes a good midwife. So I just did a quick brainstorm, and probably if you brainstormed, you'd come up with some of these terms. I'm sure the most important thing that we want is a safe midwife. We want a midwife at the end of the day who's prepared and ready for licensure, who's competent. So that's probably the top characteristic that we would think of if we were thinking about what makes a good midwife. But as midwives, we know that there's far more to this than just being competent. The clinical skills, the knowledge, really, really important. We have definitely got to hone those skills. But there's professional behaviours as well. There's things like being punctual, our attitude, our ability to be reliable, actually being professional in all our behaviours. There's our ability to be critical thinkers, to use evidence to support our practices. And then as midwives, we all will pick a role model. When you start your clinical placement as a student midwife, I'm sure you will work alongside someone, you'll go, her, I want to be like her. What is it about that midwife? I want you, if you're a student midwife, to think now, you've probably got someone in your mind. Who is it? And what is it about her that she does that you want to be like her? And maybe it's that she does less rather than more, because a lot of what we do to deliver woman-centered care is actually being with the woman, listening to the woman, and this notion of watchful attendance, sitting on your hands, sitting knitting. So we have this whole other set of skills which we can't actually define or maybe verbalize, but it's actually gained by experience. So only through clinical experience can you actually be a good midwife. So the clinical placement that we offer is really, really important. So the next slide, please. So looking at the evidence, we know that clinical placement is a really important exercise. It gives our students the opportunity to increase their knowledge, skills, attitudes, and their interest in the profession before they actually go into the clinical area. Maybe they have an idea in their mind of what is a midwife, but until they actually go out and practice, they can't really know what it is that they're supposed to be doing. So let's think about how a clinical placement can be meaningful. So the first thing that's really important is actually a culture of learning. Is it a teaching hospital? Is it an environment that's used to having midwifery students, or is it their first time having midwifery students? What is the pedagogical atmosphere of the clinical environment? Are the staff doing continuous professional development that the students can be involved in? Or is it a private hospital where largely the staff are being educated maybe outside of the unit or something like that? What is the atmosphere in terms of learning? The leadership style of the ward manager is actually really important. And a democratic leadership style can really support that, or a compassionate leadership style as well. One where we're really understanding and bringing the students along as part of the team, rather than seeing them as outsiders. It's really important that students feel like they're a valued member of the team, and that we're listening to them and their needs as well for their particular clinical learning objectives. In midwifery, we have a number of particular competencies that we need to achieve, and they're guided by the ICM essential competencies, which I'm sure Laura might touch on in her presentation. But we have our philosophy, which is really important to what we do. We have a particular midwifery philosophy. If we try to think about other professions, say medicine, nursing, physiotherapy, whatever other profession, what is it about midwifery that makes us a profession? It's our philosophy. So if we go to a unit which is obstetric-led or very medicalised, it can be very difficult for a meaningful clinical placement for midwives. So I'm going to talk a bit more about that as we progress. Cultural and organisational factors are very important. Things like bullying, which we see every day, and sadly we've had a lot of examples of that. And also the relationships between the students, the clinical staff, and the academics. So our job as academics is really important. We're that link person between the clinical staff and the student, and making sure that they're actually gaining their knowledge that they should be gaining for that particular placement. Next slide, please. So student satisfaction. So when we're midwifery educators, I think, and even staff midwives, if you're a mentor, we have to take this role really seriously, because actually students feel really worried and anxious before especially before their first clinical placement, but I think every clinical rotation, they get really anxious and stressed. So it's up to us really to make them feel safe, to feel comfortable, and to enjoy the clinical placement and get the most out of it. But I suppose a key challenge for this is that it's actually very unpredictable. We can't tell what that environment is going to be like, no matter how much we do preparation, orientation. I'm going to be doing orientation for my second years now in a couple of weeks. I can tell them everything, I can give them their documentation, but the bottom line is those girls could go into the labour ward on the first day and walk into an emergency situation. There might be 2 full operating theatres, staff running around the place, could be short-staffed. Maybe they do want to welcome the student onto the ward, but they just don't have the time that they want to spend with the student. So this is, really, really difficult. We're very fortunate in where I am, because actually I'm going out with them. Myself and Gina have been going out in clinical placement with them to give this kind of pastoral support and to be there if they do have any challenges. But it's important to remember that the student can feel overwhelmed, and that they might actually have a panic attack or have an emotional reaction that they don't expect, because birth is a beautiful thing, it's a miracle, but also maybe it's not what they expect, or there's something that they might see which might be shocking to them, or as well culturally, where we are in the UAE, if they're not married, they won't have been exposed to things like this. So even though we prepare them, we orientate them, at the end of the day, they might not really feel ready for what it is that they're about to see. And so our role is really, really important. Another challenge is that when they go into the clinical area, they might be competing with other professions like medicine for learning opportunities. So if there are medics out there, and they need to witness births or have certain skills and procedures signed off, that's very challenging as well. And something that we can do is to, you know, obviously see and plan the placement to see what other students are going to be there, and hopefully to prioritise the midwifery students, because we have our EU directives of 40 births, 100 antenatal checks, 100 postpartum checks, 100 newborn checks, etc., that need to be completed. And sadly, we've actually seen some evidence of discrimination and racism that might be faced as well. And I think that's something that is needing to be discussed, and you know, we need to really advocate for our students and to make sure that they feel able to speak up if they are faced in that situation. So maybe we can take this up in the discussion later. Next slide. So many components influence whether the student experiences the learning environment as a positive clinical learning environment. But we do know that if they feel like it's positive, then they feel motivated, they feel involved as a valued member of the team. And if you press there, you will see a picture of our students in clinical placement at the Corniche, and they shared this on the social media, and I thought that was really nice for them to feel like they're actually part of the team. They're up there on the social media, Dr. Jean and the students. So it definitely is helping them to feel welcome. So next slide. So this is what it will look like if there is a positive pedagogical environment. The students will feel motivated, they'll feel involved, they'll feel like part of the team. They'll have really good relationships with other team members. You know, when you go to the ward to find the student, they all know student midwife Fatima is here, she's doing a great job. And also we're able to explore and reflect on the practices. Next slide. So the students really do need this preparation for the clinical learning environment, and they need to feel like they're going to be supported. They need to feel like they're free from fear, so they shouldn't feel like so nervous about working with someone, or you know, afraid to speak up about something that they see. They need to be feeling supported, and we need to have respect for each student as an individual as well. The staff, when they see the students, should view them as younger colleagues rather than, you know, maybe that they're in the way or a hindrance, which we hear sometimes that mentors are saying, oh, more students. But actually they're younger colleagues and they have knowledge, they're willing to learn, and they're really motivated, enthusiastic, they're delighted to be there. And when the clinical learning is environment, they develop really good positive problem solving skills and increasing their knowledge. So next slide. So before our clinical placement, we didn't know what midwifery looked like in the UAE. So this is a tool that I want to share for anyone who's in other countries, maybe other Middle Eastern countries, Eastern Europe, wherever you might be. This is a tool which was developed by the WHO in Europe as a self-assessment guide, and we use this with stakeholder meetings. We went into stakeholder meetings with midwifery management, with midwives, and we asked them to complete this these questions, and it was a very nice experience to help us to understand how midwifery looked without sort of being confrontational. It's very nicely laid out and it's freely available on the internet. You can go and search that. And it just helped us to understand, mostly in the UAE, midwives are working in labour ward rather than in the antenatal area and the postpartum area. So how are we going to facilitate the learning for those students when they need to do abdominal palpations? We needed to ensure that obstetricians were on board, that they would support them to do antenatal appointments where normally perhaps it wouldn't really be a midwife. But we've been so lucky to have such brilliant collegiality from our obstetric colleagues. And from all of the midwifery staff that we've encountered in all of our clinical sites. We have students now in the Corniche, in Dhabi, Emirates, in Sheikh Shakbat Medical City, and it's really, really been excellent to see the support. So next slide, slide 12. So I want to, again, just for countries who don't have a lot of midwives or a strong midwifery practice, I want to highlight this document from the ICM. It's a policy document which defines what an enabling environment for midwives is. And it's one that supports the infrastructure, profession and system level integration needed for midwives to effectively practice within their full scope of work. This is really important because we need our midwives to graduate and to move towards licensure, able to perform in their full scope of midwifery practice, even though that might not be what they're seeing. Because when we only have 10, 15, 20 midwives in a unit, they're not available to work in every area, but we need them to feel able to do that. So it's very important that actually when we're in these countries, we advocate for midwifery. So our team has been involved in the regulation of midwives here. We've been involved in writing the scope of midwifery practice. We've been sitting on national committees to progress midwifery as a profession as well, because midwifery needs to be on the agenda so that these midwives are not going to graduate working as obstetric nurses. Essentially, we need them to be leading the birth, leading the care, able to do key skills like intermittent auscultation, able to do possibly pool births. They're coming in now. We're very excited about that. We need them to be exposed to many different midwifery practices that perhaps are not routine at present. But like I said, we're very fortunate that we've been out there with the students in practice. We're able to help them to reflect, which brings me on to the next slide. Critical reflection, which is a key aspect of what we do. If you're going out there and practicing, you have to be a reflective practitioner. Without reflection, the placement is meaningless. You have to think about what you're seeing, apply it, and compare it to what you're seeing and thinking about the situation and how did you feel about it, evaluating the care that you gave and how would you improve going forward. And we're lifelong learners. You will never be perfect. You could be 15, 20, 40 years qualified, I'm sure, and you will always think of ways that you could have improved the situation. And, I met a student this morning and she said to me, Miss, I apply this in all my lifelong situations now. I have a situation that occurs and I try to reflect. Something happens in my family life or in my home and I think about it in a reflective way. So you can use very simple reflective model like what, so what, now what, or you can use Gibbs reflective cycle model, whatever it is that can help you to reflect about a situation. And like I said, when you have especially emotional challenges, maybe you're faced with a neonatal resuscitation by surprise or postpartum hemorrhage, whatever emergency it might be, maybe you're taken by surprise by how you reacted that moment. You think that you're going to be able to follow that protocol, but actually there's a block somehow. You need to work that through and think about, well, what am I going to do next time? What strategy do I have? Can I take a big breath in and count to 3? What am I going to do that is going to help me to perform? Because at the end of the day, you have to be able to perform. So I would urge all of our listeners tonight to, if you haven't done a critical reflection in a while, do one, because it's also part of our revalidation for the NMC. So in conclusion, I will say that we really need to be proud of our role as midwifery educators, and we need to be very supportive of our midwifery students in clinical placement. It's a unique experience for them. I think it can become a part of our routine, what we do. But our pastoral care role is really, really important. And for students or for countries that are starting out on their journey and developing degree programs, reach out to me and Gina. We've just gone through this process. If you're wanting to speak to us about what we did, we're very open. But I will say that your stakeholder meetings, getting everyone on board with your plans for the program, but making sure that your clinical placement have meaningful learning objectives, that you're actually being exposed to full scope midwifery practice is really important, and using your critical reflection as well to help the students to make sense of their clinical experiences and their situations. So I hope that's been useful. Thank you very much. You can go to my last slide. If you want to contact me, my email address is there, and follow me on social, but I'm looking forward to our discussion.
And you'll find, thank you so much, Maeve. And you'll find some of the references on the resource list as well. And I think that was put beautifully. I like the reflection aspect, Maeve. That was lovely. Really good. And I think using the mate tool can be a huge help. And I have to say a special welcome to Qatar and UAE, because I think they might be in the majority this evening. I can't understand why at all, but hello and welcome to this evening's session. It's lovely. Thank you, Maeve. Now we're going to move without further ado onto our next speaker, and I'm delighted to welcome Moya Falcon, who's a clinical midwife specialist at the Hamad Medical Corporation. She has 23, I know she doesn't look like she does, no, neither of them do, 23 years of experience as a midwife, starting at Middlesex University. She's worked in London. She's was very passionate about birth centres, water birth, community midwifery, and breastfeeding. She's worked in Spain, and where she founded and directed the Blossom Maternal Centre, a pioneer of its kind in providing holistic care, including home birth. I think this sounds like another hour presentation. To me, that sounds really good. She's multi-talented, and she's spoken at national and international venues and all media. So she's very used to TV and radio interviews, etc. And she's at the moment working as a clinical midwife specialist in Qatar, creating and supporting midwife-led services, and most recently leading the baby-friendly hospital initiative project. And she's also created an innovative simulation-based teaching program for breastfeeding skills and competencies also. So welcome, Laura. The screen is now yours, and thank you for coming this evening.
Okay, thank you very much for that beautiful presentation. Can you hear me well?
Yes, I can hear you well. Yes.
So first of all, I want to thank you for inviting me to this opportunity. For me, this is amazing, wonderful experience. And also I would like to thank Dr. Maeve for suggesting me. So I'm so delighted to be here today because I've been following for many years. And I think your role, what you're doing is amazing in this, giving information to midwife, a student midwife, being in social media and everything. This is what is the actual need, really. So from my side, I just wanted to highlight, before I start with my presentation, because the examples I'm going to give, I'm going to take the opportunity to share a little bit of the experience in Qatar. As you mentioned before, in different countries are with different stages, and this is very interesting. And I think Middle East is an area as well that is not very well known worldwide. And also within the Middle East, we are different stages. So Dr. Maeve, she works in Abu Dhabi, the midwifery services, even though she's mentioned that still is not fully covered, all of them, it is more advanced than in us, okay? And also the university, you started a few years ago, and in Qatar, it's just coming this year. So for us, I have to say that when I started working here 7 years ago, we didn't have midwifery services at all. Just for you to have an idea when I'm talking about education as well, because I'm going to give examples of our in-service education. So we started with postnatal community services. This is the first success midwifery service. Then we have done the midwifery-led unit in antenatal. And also we have managed to open a birth room, midwifery-led birth room. And that's where we are right really now. So still, implementing from policy making, midwifery policy, a scope of practices, working at national level. But Qatar really is really looking forward to implement midwifery, because we know, and they know, and they're aware that the importance of midwives to make a difference in women's and babies' life. So without further ado, I want to start to talk about my presentation, where we are talking all about positive clinical learning environment. But the perspective I'm going to be sharing today with you is about what are the global standards we have and what tools can we use, particularly in countries where midwifery also is not established, but also to make sure that we are all in the same page in the standards according to the ICM and WHO. So, so what are these guides I'm going to present to you?
You're muted, Laura.
Sorry, I'm clicking. Yeah, so the framework for action for strengthening midwifery education, I think this is a very important document which has been developed in partnership from WHO, UNICEF, United Nations Funds, and ICM. Okay, this document or report, it not only shows us the evidence of the impact of quality midwifery education on outcome for women's newborn children and adolescents, but also it's a guide to develop high-quality, sustainable pre- and in-service education, but also highlights that the best midwifery education is based on what women and newborns need, and very importantly, and this is something I want to highlight, that interprofessional learning and teamwork is effective. Okay. This framework also gives us an important 7-step action plan to strengthen this quality midwifery education. And this action plan includes 7 steps for all stakeholders who are involved with maternity and newborn health. This action plan supports implementation, obviously, the global strategy for women's, children's, and adolescent health, 2016 to 2030. And as you can see, it moves in a similar to a quality project cycle, moving through a cycle of act, monitor, and review, which is continually updated to review the progress, identify barriers, and make the changes needed. At each step, monitoring and evaluation of change takes place. So as you can see, it is important, like in the case of Qatar, we have to start with the step 1, strengthen leadership and policy. So we created our midwifery policy, for instance. We are now developing the midwifery strategy, education strategy. So we are looking at exploring what are the gaps in education, in midwifery education, in the hospital. We are asking them, what do they need? What do they feel? We have done surveys to the midwife or existing midwife. By the way, I haven't mentioned that in total, we only have about 150 midwives. And we are talking about a huge organization with several hospitals, with more than 20,000 births per year. So as you can imagine, this is important as well. So the survey, we talk to them, ask them what they feel they need. We look at AMOC reports as well. But this is just what I want to highlight. This is important to do a needs assessment. And as you can see, and in this cycle, we have to be continuously including monitoring. We cannot create one program and then get stuck in there for years and years without monitoring if it's working or not. And also, obviously, review and then evaluate, and then again and again keep monitoring all the time. So this is an important cycle that I wanted to share about the 7-step action plan. Also, they share the full scope of midwifery education and care, because again, as Dr. Maeve mentioned before, in different countries, even though we are all midwives from different countries, I have learned that we are not at the same level of the standards of the ICM. So that's why it's important to have standards of what is the full scope of midwifery. In countries like in the Middle East, as it's more focused about intrapartum, but that's why we have mainly the midwife, but also we have the midwifery-led care, the antenatal care, obviously, and all these scope of midwifery education that we have to ensure that we cover in order to raise the standards. So now I wanted to share the ICM Global Standards for Midwifery Education. I don't know if everybody's familiar with the new website, and I recommend everybody to navigate about it because it gives us enormous resources. So the ICM Standards of Midwifery Education, as you know, are essential pillar for the ICM's efforts to strengthen midwifery worldwide by promoting high-quality education programs. These ICM standards for midwifery are based on foundational ICM core documents and positions statements. And these standards address inclusion of the essential competencies of midwifery that is mentioned already as the basis of the midwifery curriculum. So the purpose of the ICM standards for midwifery education are here. So they give us set benchmarks for programs that prepare students for entry to practice, but also promote high quality teaching and learning processes, ensure the ICM essential competencies for midwifery practice are included in their curriculum, provide a framework for designing, implementing, and evaluating educational programs, assist programs to engage in continuous quality improvements and ongoing process, enable systematic reporting and quality indicators to the public, midwifery profession, healthcare system, contribute as well to systematic improvements. So as you can see, continuously quality improvement processes, and also, additionally, the ICM standards for midwifery education may be used to promote a common understanding and approach to midwifery education, assist other midwifery accrediting agencies, government, health education departments, and education institutions, and it serves as a guide, for all the programs, but very importantly, meeting always the ICM midwifery education and accreditation program. I've got one of the ICM global standards for me, and I don't know if you see, but it's a very comprehensive document, and you can download it from the website, but it's, at the same time, it's quite easy because it's only 10 pages. But what I wanted to share, it is for people like me working now in countries like in the stage I have shared that we are, it is very important because it covers different categories, like how should be the program governance, how should be the faculty, the students, the midwifery program and the curriculum, and also the quality improvement and a list of resources. So it is really an important document to refer to when you are developing programs. The other thing I wanted to mention, it is about the definition when they're talking about the midwifery education. Is the process of learning it is the process of learning theory and developing the necessary skills and behaviors to become competent midwife. So what I'm highlighting is skills and behaviors, because so far I feel like if we've been focusing a lot in education, but we know nowadays, understand how important it is to ensure that our students and staff have the proper skills according to the competencies, but also the behaviors. And what about the behaviors? What can I say? Particularly for me is, I think sometimes working in this type of environment, in service, it is very challenging to change the behavior. Right? So that's why it's so important, and I'm going to share in the next slides what tools can we have, we utilize to improve the behaviors, so these are the competencies, as you can see, and I think everybody knows about the competencies, essential competencies of midwifery practice, which is in 4 steps. We have the general competencies, pre-pregnant and antenatal care, during labor and birth. But I don't want to focus on that because we all know this, I think. But I wanted to share something very nice. I had the opportunity to attend recently to the ICM presentation of a new tool, which is this midwifery tool they're using for competencies, which is based in digital learning. So what I'm talking about, changing behavior, I like to talk about simulation use as a part, supporting very much about the changing behavior. And I think when we're utilizing simulation, it is important to have simulation tools, like obviously the mannequins, but also incorporate to have another knowledge about another tools, which could be like digital learning solutions, like they presented the other day. I really like this webinar because they titled the Transforming Midwifery Education. And yes, we are moving to another paradigm of teaching. We have to move from the education and putting the PowerPoints and guiding, and doing like only focusing in the theory, where we should be focusing more in hands-on practice and developing the skills and reflection, you know. So for that, that's what I wanted to share, what they were sharing the other day in the ICM presentation. I didn't mention, but I think it's worth to mention, and I have to mention that it was presented by our chief midwife, Jackie Dunkley, also the chief executive, Sally Perman, and Anna Baglas. So this, I like it very much, this webinar, because there was the perspective experience of this new digital tool, which is shared by, utilized by mentors, you know, lecturers in the university and educators. And I made some notes about what is the feedback in using this. So for instance, they said, the students said, I felt more prepared. I felt not evaluated. I felt in a safe environment, this is very important, to feel more relaxed. Because as we know, as Dr. Maeve was mentioned before, when sometimes we go directly to the clinical environments, you know, it gives us a lot of stress. So what is interesting about these sort of tools is that they say they can repeat and repeat and repeat it again. And very importantly, it is a peer-to-peer modality. So the students, they do it in their own time, you know, and they can practice it again. And what is interesting is that they do this immersive, you know, because this is what I advocate a lot, immersive practice, education and simulation. So where you change the roles. So for instance, the first time I heard about this sort of education, actually was a long time ago, was another male midwife who is Spanish. I'm sure you know, Felipe Castro. He's been ages in UK, and I really like it in a conference when he gave an example about water birth, and then they were putting obstetricians into the pool. I mean, simulating pool, water and everything, as you can imagine. This is what is important. Because first of all, he was introducing the fact of doing interprofessional, which I think is important as well to when we have midwife challenges, and particularly in countries like us, where midwifery is a new profession. And also not only about the interprofessional, but also about being aware about your attitude when you put in that in the skin of that person. So as I say, if you simulate like you are the mother, or you simulate like you are the midwife giving information, so it really, they realize more about the automatic behavior, which may not be ideally in our scenarios. So for instance, I can share the example of my own experience in this course I implement for breastfeeding in particularly, which I think is quite pioneer, because we don't have any, as far as I know, specific for breastfeeding using simulation. Obviously, I use the WHO toolkit for competency verification, which I help a lot. I use the scenarios, but what is innovative about this is about using as well this PEARS debriefing method. So we do these scenarios where we do debriefing. We tell them to these participants that they are not going to be assessed. This is a safe environment. This is just for them to practice. And we highlight that it's not only for them to practice the skills, but also, we are going to be focusing very much in the counseling skills and the attitudes, because that's what we want. And then when we are doing the scenario, it is interesting because sometimes I do like I'm the mother, and then I have the participant who is doing as a midwife. And then, for instance, they are going to help me with the breastfeeding issue, and they touch the breast. That's an example. And I say, oh, you're touching my breast. And they say, and it's like, well, oh, sorry, I didn't realize. So, you know, these sort of examples, they do realize of the automatic behavior by doing these scenarios. And what I like it also, when we finish the scenario, obviously we have a debriefing time where it is led by them, and I ask them, how do you feel during this scenario? What do you think it was good? What do you think was not that good? And it's so interesting how they reflect about their practices with this methodology of simulation. So this is what I wanted to share a little bit about this. And when was presented this digital tool, I was amazed as well, because when we're talking about quality and improvement, as I mentioned before, it is important to gather data. So what the experience of the university lecturer, she was saying the other day, that she said that it gives us, using this tool, real-time data and adapt according to the results to the needs of the students. So I think this is amazing. So the technology nowadays is helping us a lot. And that's what I think we have to utilize really, and be aware that there's so many tools we have nowadays. And this, I think I'm very grateful to the ICM for presenting this. So I'm just almost finishing. So this was a part, these are some screenshots about the ICM web as well. So as Dr. Maeve mentioned, we have the core documents about enable of environment policy. And also, it is important, I didn't want to finish without highlighting that it's also important to look at the competencies of the midwifery educators. It's not only to the students, but also we have to review. And this is one of the things we are reviewing right now, because we have an environment, as you can imagine, because we don't have many midwives. And obviously, we have to count on the obstetric nurses that we have as well, who are educators, who've been working many years for educating students, obstetric nurses. And so that's why we have to look at the competency. And this is something very strongly recommended by the ICM standards. So, and that's what I wanted to share. Another tool by the WHO organization, which is the essential childbirth care. The essential, the EBC, essential childbirth. Sorry, because I missed it. The essential childbirth education tool, which is important for to have a standardized. So when we are giving information about childbirth, about birth, about all the midwifery standards, this tool can be utilized in an innovative way, fun and challenging, in service education for all health professionals who are involved in the maternity and newborn health. So we have to think about this as well. It's not only about midwifery, only midwife, but also the other health professionals who we know that are involved in the health care of them, to make sure that we are in the same board. We are giving evidence-based information. And just to finalize, also, I wanted to share, come back to the state of the world of midwifery, where it says building a health workforce to meet the needs of women, newborns, and adolescents everywhere is so essential. So yes, we are obviously promoting midwifery, but when we don't have it as well, we have to ensure that the rest of the health professionals can, they have the tools and they have the standards that the ICM is giving us to ensure that we give the proper women-centered care. The last slide is just, this is summing up, what are the standards, what is needed to have quality midwifery care, which includes attitudes, knowledge, empathy, skills, respectful care. So thank you very much. I hope so. I have shared what I wanted to share. You got an idea about the ICM global standards. Thank you.
Fabulous. Thank you, Laura. Goodness. I'm a bit breathless now with all this and all this content, and how there are so many different threads to what you were saying, Laura, and really important for us to know wherever we're working in the world, because we in the UK probably take things very much for granted. Some places in Europe take it very granted. We've got a long history. We've been brought up with the EC directives. We've been brought up with the ICM proficiencies and competencies. But for some people, this is the framework they're learning, which is fantastic. And I think what when you were speaking, I've jotted down theory practice gap, because as you were talking about, especially about the simulation, which I think is, I always find it a really good way of learning, you have to have the theory, but you also have that practice and putting people in situations. So getting a student to play the mother, not play the mother, but feel what the mother feels like, getting to feel what it feels like to be the midwife can be really useful, because it's just a different perspective. It's putting yourself in someone else's shoes and thinking, well, what would it feel like? Or a father, or whatever, you know, whatever mechanism you use. And it made me think, if you know, as a teacher, and you both will have heard this, where students say, well, I know we learned that in the classroom, but the midwife said, that's just for the classroom. We do it differently here. And that's gone on a long time. And I think us as practitioners, as well as educators, need to be very aware of that. This is what the value of being in clinical practice can do, because if you're lurking about, they don't say it. Anyway, we've had some really good questions, and one question is from Hawa Hadid, who says, how do you think, and this is a lovely question, how do you think AI will affect midwifery education in the near future? I think that might be one for both of you, but do you want to say something on that, Maeve? Artificial intelligence. My
I think it's
goodness.
very exciting. I suppose here in the UAE, obviously, we're very technologically advanced in general, and we're a country that really embraces technology, and where it can be used, it will be used and will be adopted quite quickly. So I think that we all just need to get used to this notion of AI, because it's here whether we like it or not. It's fantastic. I personally think that there is so much potential to improve care, to improve the systems that we use, even in terms of, say, documentation and things like that. We don't possibly understand, but our students will. They will have jobs that we can't even conceive yet. I am sure that there will be roles for midwives in 10 years and 15 years that maybe they'll be, I don't know, developing apps, whatever they'll be doing. But AI is here whether we like it or not. I know where I worked in Cork, they were looking at research in the Infant Research Centre, Irish Centre for Fetal and Neonatal Translational Research. We have people there doing research on algorithms for the EEG, for neonatal baby brainwaves, that they can detect seizures now, which is really, really groundbreaking as an early intervention to prevent, long-term disability for neonates, for example. And they're also looking at alternatives to CTG, which is very exciting. We need an alternative to CTG. Is AI the answer? I think possibly it could be, but they're doing research, and it's really exciting to see that they're implementing research so fast, because other research that they do is not implemented so fast. But I think that's the beauty of having a translational research centre as well, is that the research is done on site and the changes are implemented quite quickly in clinical areas. And then the findings can be disseminated quite quickly as well, and things do roll out. So in terms of midwifery education, probably you're thinking about things like ChatGPT. Maybe that's where you were going with this. That's a challenge, but in countries like this, in the UK, you probably have a different situation than here, because English is not the first language. So I think we can harness it again to improve the way that they write, rather than criticizing them for using it. Thinking about, well, is that what you want to say, or how can we improve your writing using it, rather than only using it. Different universities are coming up with different policies as regards, academic integrity. I think, obviously I can't comment on every single college or what's being done in every university, but I do think that there are so many different AI uses, even in terms of research, different ways of gathering literature now, literature reviews. It's amazing. So going to do a literature review about it soon, actually. So maybe I'll come back on and talk about that sometime.
Well, well, that was a good question to start with. Okay,
Great
thank you for that. We've also got another question. Oh, Nikki Attridge, hi Nikki, would like Maeve's email address. That was very interesting. Thank you for her.
Okay, no problem.
And then we've got Sheila Brown. It's a comment, and I think it's talking, actually, both of you in a way alluded to it. She says it's important to role model across environments, so also educators in the university, and the findings from stakeholders' involvement in my PhD study. So Sheila Brown, that's a lady to watch. And then we had a question from Alice, who was saying about mentioning CPD in practice as students. Some universities are asking us not to count CPD hours in placement books. There's too much time being taken from clinical hours. And there is a set number of hours that have to be achieved, certainly in Europe. I'd like to keep CPD with the multidisciplinary team as hours. What do you suggest as we can accomplish this? I don't know if that one will be a Maeve or a Laura question. Hours.
So what is the question? Is about the CPD hours?
Yes,
in the clinical area?
Yeah, using CPD hours.
For undergraduate students.
It's a yeah.
For me, I can share from our, because I'm working more in service education, and we do have different modes of teaching and to get the CPD points. And for instance, we have we call it clinical teaching, because also we have the challenge of the staff to be as a worldwide, we are short of staff everywhere. So it is a challenge for them sometimes to move out and go to a teaching session itself, outside the area. So we have what we call it the clinical teaching. Normally we do like a 1 hour, and it can be different things, but it is within the environment, within the clinical environment. Could be in a mode of teaching, in a practice, as a workshop. I don't know if that answered the question.
I'm not sure. I think that was quite a difficult question in a way, because I mean, students can learn all sorts of things. It doesn't necessarily have to go. I know people get very exercised in making sure everything is recorded in the books, the assessment books, and I know that's something. I'm not sure if Alice is a UK student or from UAE, but she may allude on that one.
I didn't include the fact that we actually have adapted the UK EMORA to the AMORA.
Yeah.
We're using a similar document, but I think in the UK they're very clear about that it needs to be direct clinical contact with mothers and babies. So I'm not. I think that possibly in the UK the CPD would be outside of the direct contact with mothers and babies, whereas we're finding our feet, and really there is no precedence for us. So we're kind of fortunate in a way, because we're setting the scene for the rest, but these are decisions we need to make as we go forward. The first batch are like the guinea pigs, really, in a sense, because we're kind of setting our standards now. But we're learning as we go. I mentioned to you in passing, Sue, that the number of hours that we are doing is slightly less as well than the UK, simply because our time doesn't permit it. But we benchmarked with some other programs, and so we're doing 1,700 clinical hours rather than the 2,100 in the UK. But we have benchmarked it with other programs. So I don't really know if anyone else in the Middle East is here, what their experience is with the clinical hours, but I think in the UK, direct contact with mothers and babies usually.
Yeah, I think it's a few more, but I think that'll get the debate going. Now we've got a few comments from Maura O'Callaghan. Hi, Maura. And she says, I love having students. They teach me the most up-to-date information. That's wonderful. Thank you, Maura. And then Diane Garland says, thank you for the presentations. Always great to hear what's happening in other countries. And that's absolutely so. And that's sure. And I think what's fabulous is that you've both brought in the kind of ICM WHO in action. And you've made it look, actually, I won't say simple, because it isn't. It's so complicated. And so, because you have to start with the country, and so I think some countries think, you can magically come up with a program and magically do everything. But of course you need so much. And I think, Laura, that's what you really highlighted for me, was the importance of getting the whole I can't think of the word, the foundation set up, so everyone is bought into the system, making sure you've got some clinical practice that students can access, and of course making sure the political impetus is there, because it's no good organizing something that's never going to happen, and that's obviously very close to your hearts. Now, I always say this hour is the fastest hour in the week, and it has just flown by. And I want to say a huge thank you to Maeve and to Laura for really bringing education to the fore in such a lovely way. And we'll have them back, because I've asked them really to do a huge topic in a very short time. So thank you so much to both of you for being with us this evening and sharing your knowledge and your expertise and your experiences over there. Now, I'm going to say also a thank you to Jack in the background. It's not Angelo tonight, it's Jack, making sure everything's beautifully recorded, ready for the week, this week, and the Friday morning at 6 o'clock in the morning podcast, and the Tuesday recording. So you won't have missed anything. And you might want to run this through again, because there's some very meaty stuff, and you might want to just run it through. I think that would be quite helpful. Also, thank you to Paul for feeding me the questions, which was lovely. I think there's another little comment coming through somewhere. And also just to say, next week we're going to have, of course, it's the IDM is on the Sunday, but we'll have a celebration of International Day of the Midwife. We've got the lovely Catherine Guttridge joining us to celebrate International Day on Wednesday, same place, same time, same quick hour, faster than any other ever. And don't forget to book for the Midlands Festival on the 14th of May if you haven't yet. And I'm going to say another big thank you to our lovely guests, and a big thank you to our audience who've been so good, contributing and listening and participating. Take care. We'll see you same place, same time next week. Take care.
Thank you. Thank you very much.
Thank you.
Mhm.